Imagine this. You wake up one morning feeling a little off, maybe some tingling in your toes. You brush it off, thinking it's nothing. But as the day progresses, the tingling spreads, climbing up your legs, leaving you feeling weak and unsteady. Within days, you find yourself paralyzed, unable to move your limbs, struggling to breathe. This terrifying scenario is the reality for thousands of people each year who are diagnosed with a rare but serious autoimmune disorder called Guillain-Barré Syndrome, or GBS. GBS can strike anyone, regardless of age, gender, or ethnicity. It often appears seemingly out of nowhere, turning lives upside down in a matter of days. The good news is that with prompt diagnosis and treatment, most people with GBS can make a significant recovery. This essay will delve into the complexities of GBS, shedding light on its causes, symptoms, diagnosis, treatment, and prognosis. We will explore the experiences of real people who have faced this challenging condition, offering hope and insight for those affected by GBS and their loved ones. Guillain-Barré Syndrome is a rare disorder in which the body's immune system mistakenly attacks the peripheral nervous system. The peripheral nervous system is like a vast network of wires that transmit signals between the brain and spinal cord to the rest of your body, controlling muscle movement and sensory information. In GBS, this vital communication network comes under siege. The immune system, typically our defender against harmful invaders, turns against us, damaging the protective covering known as the myelin sheath that surrounds the nerve fibers. This damage disrupts the transmission of nerve signals, leading to a wide range of symptoms, from mild weakness to debilitating paralysis. Understanding how GBS affects the nervous system is crucial to comprehending the wide array of symptoms it can produce. It's important to note that GBS is not contagious and does not directly affect the brain or spinal cord. The exact cause of Guillain-Barré syndrome remains a mystery, but researchers believe it is triggered by a combination of genetic predisposition and environmental factors. In many cases, GBS develops shortly after a bacterial or viral infection, suggesting that the immune system, while fighting off the infection, may mistakenly target components of the nervous system that resemble the invading pathogen. Some of the most common infections associated with GBS include Campylobacter jejuni, a common cause of food poisoning, cytomegalovirus, Epstein-Barr virus, and Zika virus. However, it's important to emphasize that developing these infections does not mean you will get GBS. In fact, only a very small percentage of people infected with these pathogens go on to develop the syndrome. Other potential triggers being investigated include surgery, trauma, influenza vaccination, and certain cancers. However, more research is needed to establish definitive links between these factors and GBS. Guillain-Barré syndrome often begins with tingling and weakness in the feet and legs, which can spread rapidly to the arms and upper body. The weakness is usually symmetrical, affecting both sides of the body equally. As the condition progresses, the muscles become increasingly weak, leading to difficulty walking, using the arms and hands, and even breathing. In severe cases, GBS can lead to paralysis, requiring a ventilator to assist breathing. Other symptoms may include difficulty with facial movements such as speaking, chewing, and swallowing, pain, often described as a deep, aching pain that worsens at night, abnormal heart rate and blood pressure fluctuations, and problems with bladder and bowel control. Diagnosing GBS involves a combination of clinical evaluation, nerve conduction studies, and lumbar puncture. Nerve conduction studies measure the speed at which electrical impulses travel through nerves, while a lumbar puncture analyzes the cerebrospinal fluid for abnormalities. Section 5. Stories of strength, real-life experiences with GBS. Behind the medical terminology and scientific explanations are real people whose lives have been touched by Guillain-Barré syndrome. Sarah, a vibrant young woman in the prime of her life, was preparing for her wedding when GBS struck. What started as a tingling sensation in her toes quickly escalated, leaving her paralyzed from the neck down within days. Facing her wedding day from a hospital bed, Sarah's spirit remained unbroken. With the unwavering support of her fiancé, family, and medical team, she embarked on an arduous journey of rehabilitation. Through grueling physical therapy sessions and sheer determination, she slowly regained her strength and mobility, taking each step with newfound appreciation. John, a retired teacher and avid hiker, found himself battling GBS after a bout of the flu. The weakness started in his legs, making it difficult to climb stairs. Soon he couldn't walk unassisted. Fear and uncertainty clouded his mind as doctors worked tirelessly to stabilize his condition. Despite the challenges, John refused to give up. With the love and encouragement of his family, he pushed himself through therapy, drawing strength from his memories of conquering mountain trails. His journey was long and arduous, but John's unwavering spirit and dedication to recovery prevailed. Section 6. The road to recovery, treatment and management. While there is no cure for Guillain-Barré Syndrome, treatments are available to reduce the severity of the immune attack and manage the symptoms. The goal of treatment is to support the body's natural healing process and help individuals regain their strength and independence. Two main treatments are used to speed up recovery from GBS. First, intravenous immunoglobulin, IVIG. This treatment involves injecting high doses of antibodies from healthy donors into the bloodstream to help neutralize the harmful antibodies attacking the nervous system. Second, plasma exchange, plasmapheresis. This procedure involves removing the liquid portion of the blood, plasma, that contains the harmful antibodies and replacing it with healthy plasma or a plasma substitute. In addition to these treatments, supportive care is essential for managing the symptoms of GBS and preventing complications. This may include pain management. Medications can help relieve muscle and nerve pain. Physical therapy. Regular physical therapy is crucial to maintain muscle strength, prevent muscle atrophy, and improve coordination and balance. Occupational therapy. This type of therapy focuses on improving daily living skills such as dressing, bathing, and eating. Respiratory support. In severe cases, mechanical ventilation may be necessary to assist breathing. Section 7. The importance of early intervention. Early diagnosis and treatment are crucial for improving outcomes in Guillain-Barré Syndrome. The sooner treatment begins, the better the chances of limiting nerve damage and reducing the severity and duration of symptoms. If you or someone you know experiences sudden onset of weakness or tingling in the extremities, especially following a recent illness, it is essential to seek immediate medical attention. Timely intervention can make a significant difference in the recovery process. With prompt and appropriate care, most people with GBS can recover fully or with minimal long-term effects. However, delays in diagnosis and treatment can increase the risk of complications and long-term disability. Therefore, it is crucial to be aware of the signs and symptoms of GBS and seek medical attention immediately if you suspect you or someone you know may be affected. Section 8. Living with Guillain-Barré Syndrome, long-term outlook. The recovery process for Guillain-Barré Syndrome can be long and challenging, often taking months or even years. While most people experience significant improvement with treatment and rehabilitation, some may continue to experience residual weakness, fatigue, or pain. Living with GBS may require ongoing medical care, physical therapy, and lifestyle adjustments. Support groups and counseling can provide emotional support and practical advice for individuals and families navigating the challenges of life after GBS. Despite the challenges, it's important to remember that GBS is not a life sentence. With the right support, individuals can regain their independence and live full and meaningful lives. Section 9. A beacon of hope, research and advances. Researchers are making significant strides in understanding Guillain-Barré Syndrome, paving the way for new treatments and, hopefully, a cure. Ongoing research is focused on identifying the specific triggers of GBS, developing more effective treatments with fewer side effects, and improving methods for early diagnosis and prognosis. Clinical trials are underway to evaluate promising new therapies, including monoclonal antibodies that target specific components of the immune system involved in GBS. These advancements offer hope for more targeted and effective treatments in the future. While Guillain-Barré Syndrome remains a complex and challenging condition, ongoing research and advancements in medical care are providing hope and improving outcomes for those affected by this rare disorder. As we continue to unravel the mysteries of GBS, we move closer to a future where this debilitating condition is no longer a threat. If you found this information valuable and want to stay updated on the latest in medical research, don't forget to subscribe to our channel for more intriguing content.